So now we have two very complimentary singers, passionate and inspired by broken hearts, I guess, from the video. So nice to have you both here. Two vet cardiologists from Virginia Tech in the US. We have Giulio Menciotti, Assistant Professor and Chief of the Cardiology Service at Virginia Tech.
Happy to be here.
Yes, likewise. And Dr. Michele Borgarelli, Professor of Cardiology and Director of the Comparative Cardiovascular Laboratory at Virginia Tech.
Thank you. Very happy to be here too.
Yes. I know you've been working together for a long time, and including on the Journal of Veterinary Cardiology, where Michele, you're co-editor-in-chief, and you, Giulio, you are associate editor. You both have a lot of years of experience, and we're here to talk about how to diagnose this disease, what kind of tests and examination exist, when to start the treatments, and we are very excited because you have some new findings from the recent Look Mitral study. So we have lots to discuss. Giulio, let's start with you. How is the myxomatous mitral valve disease diagnosed in dogs?
Yeah, Vic. So the most commonly used tool is probably the stethoscope, right? So the auscultation of a loud murmur in a small breed dog, or even better, in a dog that is from a predisposed breed, like we heard from Luca just a few minutes ago, it's pretty confidently a diagnosis of myxomatous mitral valve disease per se. However, we have some clinical impression, but also now supported by some data that echocardiography is a more sensitive way. So we have done this study from hundreds of Cavalier King Charles Spaniels, and as we can see from the graphic, while dogs with mild to moderate mitral valve disease, we have about 2/3 of them that they have an auscultable murmur. If we use just a murmur, we're going to probably miss 70% of dogs that only have mild mitral regurgitation. So overall, auscultation is probably most commonly used, but echocardiography is a little more sensitive.
If it's so good at diagnosing the disease, why not use it all the time?
That's a very good question. So with recent machines, and as the equipment gets better and better, we can say the echocardiography sometimes is even too sensitive at this point. We can see here, this is like a classic example of a dog that has a trivial or even less than trivial mitral regurgitation. And this intermittent regurgitation is something that as machines get better, we find more and more often. And at this point, we don't know what's the clinical significance of dogs that have this trivial mitral regurgitation. We know from the human standpoint that they had the same experience a few years ago, and they've updated their guidelines for which having very small amount of leakage from some of the heart valves is now considered physiologic.
Okay, so this is interesting. So do you agree that a small patient with no or very soft murmur would be unlikely to have significant MMVD?
Yes, 100%, no significant MMVD.
Thank you, Giulio. Michele, how can we identify patients who are more likely to benefit from medical treatment? And is the presence of a loud murmur enough?
Absolutely. I think the loud murmur is part of the process. As mentioned by Giulio already, it's unlikely that a dog with a very soft murmur has a significant mitral regurgitation. From this perspective, we need to remember that the ACVA guidelines for identifying dogs with significant mitral regurgitation, they may benefit from treatment. They suggest that these dogs should have a loud murmur, a murmur that is at least grade 3 to identify this. However, this is just one of the criteria to identify dogs that may benefit from treatment. The other criteria, as Luca was mentioning before, is how big is the heart. So we need to have other diagnostics that actually can help us to identify patients that have cardiac remodeling and cardiac enlargement.
And which diagnostics in that case?
The diagnostic that is considered the gold standard is obviously the echocardiography, as Giulio mentioned, and other speakers before them mentioned. But however, we recognize that this is not feasible for everybody. Not everybody may have an echo. So there are other tools that can be used, and definitely radiology, it can be one of the tools that can help us identify what problem we have. And when we look at the radiography, we need to consider that it can be helpful for two things. The number one is probably the mandatory tool to identify patients that have heart failure. Congestive heart failure has been, in veterinary medicine, diagnosed by the presence of pulmonary edema on radiographs. The other aspect is assessing how big is the heart. And there is a recent study that's been published suggesting that in absence of echocardiography, where actually you cannot identify what are the clear criteria for identifying dogs B2, radiographs can help. And so if you do the VHS, so the vertebral heart score system in this dog, and it's more than 11.5, you are pretty sure that actually these dogs meet the echocardiographic criteria for being a B2. However, we also have to remember that unfortunately radiographs are not sensitive. So you may miss some of the dogs, they may meet the criteria for being treated simply because there is variability in the heart size in the different breeds. You know, we treat dogs that go from Chihuahua to Great Danes. That's always a problem. So we need to standardize it. And the other thing is obviously is in some countries is mandatory to do anesthesia for doing radiographs, and that can be another limiting factor.
So what alternatives, or if we don't have a radiograph?
So we still have another option, and this is the NT-proBNP assessment that you can assess in the blood. Several studies now, they show that the levels of the NT-proBNP are associated to two things. Number one is severity of cardiac enlargement. So the bigger is the heart, the higher is the level of NT-proBNP. And the second one, it can also be used as a prognostic indicator, as probably we will talk a little bit later about these. So identifying that there is a cutoff of 1,500 picomole per liter, it can be associated with the worst outcome and the higher risk to develop heart failure.
Thank you, Michele. So these are all the possible alternatives, right, to diagnose. Now let's talk about disease progression. Giulio, how can we identify or quantify disease progression?
Yeah, once a dog has been diagnosed already with myxomatous mitral valve disease, probably one of the most powerful and easier to assess tool would be what we call resting or even sleeping respiratory rate. So this would be the rate per minute of how fast does this dog breathe. And it's a very powerful tool, and it's very easy to assess for owners. And there's also apps now on the phone or on the iPads that can help us assess that. And they're very, very easy. You just tap a button every time the dog breathes, and then there is a countdown that stops by itself. And the part in which becomes even better by using these apps is that usually the respiratory rate is tracked over time, and you have like nice graphs that you can share with your veterinarian. And we know from some studies actually that the respiratory rate usually increases a few months before the onset of congestive heart failure. And so using these apps to track resting respiratory rate, once we already have a diagnosis, here we can see, for example, the graphs on the right, what is called RRR, resting respiratory rate. And we can see how very nicely in the line in red, it increases a few months before the dog was presenting for congestive heart failure.
And the pet owner can participate very easily without buying any fancy equipment.
Absolutely, absolutely.
And how about doing a series of radiographs to observe the disease progression?
Yeah, very good question. Yes, not only for the diagnosis of mitral valve disease, but also for disease progression. We have very similar data to the one of respiratory rate, in which the vertebral heart score, like Michele said, it starts increasing exponentially before the onset of congestive heart failure. So that's another very good tool for practitioners to monitor.
Michele also spoke about the BNPs. How about that? Is that useful?
Yeah, absolutely. Yeah, the BNP can also be useful to track disease progression and prognosis. So Michele mentioned that famous cutoff of 1,500, and that's very important because we know from recent data from the Look Mitral, here we have several curves, and these are time to event curves. And these time to event curves, on the y-axis, we have the percentage of dogs that did not have an event. And on the x-axis, we have how many months have passed since we started to look at this population. And so if we look at the couple of red lines, we have the dogs that have a NT-proBNP less than 1,500, and we see how the average survival time of this dog is actually very, very long, while the ones that have a NT-proBNP that is greater than 1,500, we have 50% of them, they reach the event at about 12, 15 months. However, it's also important to understand that we have the two blue lines, which are what happens when you take into account also echocardiographic variables along with NT-proBNP. And so we see that the difference is still there, but it's not as dramatic. So all in all, these are patients that to be monitored, they require a pretty complex and an approach that is multimodal.
You both have been working on the largest so far longitudinal epidemiological study, the Look mitral study. So let's talk about that. You've been collecting data on thousands of dogs with MMVD. Michele, tell us a little bit more about the study in itself and also about the findings. Do you see any difference between the breeds, for example?
Yeah, thank you for giving me the opportunity to talk about this study that we are very proud. As you mentioned so far, it's probably the largest epidemiological study assessing outcome and natural history of mitral valve disease in relatively unselected population of dogs. So this is a kind of registry study that essentially means you collect data from dogs that have mitral valve disease. So this is the only inclusion criteria for these patients. So we didn't exclude dogs because they had renal disease, cancer, or whatever. And the purpose was try to identify patients that actually have higher risk to develop heart failure or die for their mitral valve disease. As Luca said at the beginning, it's a very common disease, but about only 30% of the patients actually progress and die. So, and obviously we look at the breed because we know that some breeds are more commonly affected than the others. And we get some surprise there. You know, we always said that the Cavalier King Charles Spaniel are the breed that is more commonly affected and usually has a faster progression. And here in this graph here, these are again Kaplan-Meiers that just Giulio mentioned how I interpret that. You see the dogs have been divided by 3 different classes. So stage 1, stage B1, stage B2, and stage C. So when we found a difference between among the breeds is the stage B1. And interesting, if you look at that, the Cavalier King Charles, are the red curves, are the one that actually looks doing better. They have a better survival. And the Chihuahua there looks like they are actually the breed that actually progress faster. However, if you look at the stage B2, so when the dogs develop cardio remodeling, and still in the pre-symptomatic phase, or stage C, when they develop heart failure, we see there is no difference among the breed. So how we interpret this data is essentially that breed owners of Cavalier King Charles are aware of the problem these dogs have. So they're more keen to come and they're more careful to identify the disease earlier. So it looks like they are living longer or they have a pre-symptomatic phases longer simply because you make the diagnosis earlier.
There's more screening.
Yes. Mm-hmm. And so when you get to the point that essentially they develop significant remodeling or they have heart failure, there is no really difference about that. The other two things that actually we found that is interesting, this has been found in some clinical trials, but it's also confirmed by the Look mitral. First of all, is heart rate is playing a role. So heart rate in the hospital is something that we should record, and it's easy. You know, it's not requiring any specialty or any special tool to do that. And the other one also, systolic blood pressure is important. Luca was mentioning that at the beginning that, you know, the RAS activation or whatever can play a role. And we identified that systolic blood pressure is one of the independent predictors for outcome in these patients.
Then, Michele, among the findings of the study, what did you find are the most important indicators that are the best predictors of prognosis?
Yeah, not surprising. This has been reported for many years, but it's been confirmed by this large study, is echocardiographic parameters are important, and particularly the left atrium dimensions. And if we think about what Luca and Darcy explained before, it does make sense. The more severe is the mitral regurgitation, the bigger is the heart, and particularly the left atrium becomes very big. So it does make sense, actually. It's part of the equation to identify a patient with a higher risk for progression on death. And it's interesting to remember that in any clinical trials and in the Luke mitral, the left atrium is predictors of outcome. So it's something that we need to stress more and more, that left atrium dimension play a really big role on this.
And I believe that in the study you also looked at other things. We had mentioned before the cough, the renal disease, comorbidities. Can you talk to us about that?
Yeah, that is another interesting, and probably the first time that's being reported in a way that actually is being looked at prospectively, is that comorbidities play a big role in the outcome of disease. So we mentioned earlier and several times that only 30% of the dogs with the mitral valve disease, they will die for their mitral valve disease. And indeed, we figure out that if you look at just mortality for mitral valve disease, it's a relatively benign disease. I mean, they will die, they will develop heart failure, but it's relatively benign. It's a long story. But if this patient develop other comorbidities like respiratory diseases, obviously renal failure, cancer is more obvious. But if they develop other things, actually these are playing a big role in the mortality of these patients. So it's something that we need to keep in mind when we want to treat this patient, because the treatment of comorbidity may actually be a very important factor in the outcome of the disease.
And I guess speaking of which, as the disease progresses, Michele, a common complication of MMVD that can affect prognosis is pulmonary hypertension. Talk to us a little bit more about that.
Yeah, so as disease progresses, the left atrial pressure is going up. So the venous pressure is going up, the pulmonary venous pressure is going up, and then eventually these patients will have congestion of the lungs, and they may develop pulmonary hypertension. And the pulmonary hypertension is definitely an important aspect that we should consider in the diagnosis. Unfortunately, you can make a diagnosis only with echo and clinical signs, but it's important because two reasons. The number one, patient may develop pulmonary hypertension or signs of pulmonary hypertension even when the owner doesn't recognize there are clinical signs. And this is an important aspect because this is the time where probably we need to start treatment for this patient with, for example, furosemide, even if the owner doesn't report clinical signs, because the presence of pulmonary hypertension secondary to left side heart disease is suggesting this patient is congestive heart failure. And the second one, we reported similarly to what's being reported in humans, that dogs with pulmonary hypertension, these are the dogs with the red curves, compared to the dogs that do not have pulmonary hypertension with mitral valve disease, they have a worse outcome. And this is independent, again, from other predictors. So when we consider the diagnosis of pulmonary hypertension is a significant complication of the disease, and it's becoming more and more common because we are getting better in treatment of these patients, so they stay in their congestive heart failure longer, and with drugs that we have and other things that we can do. So essentially, there's more likely to develop pulmonary hypertension. It's something that the clinician should be aware of.
And speaking of that, Julia, I turn to you. How do you diagnose pulmonary hypertension in dogs with MMVD?
Yeah, the gold standard for diagnosing of pulmonary hypertension is heart catheterization. So that would mean advancing a catheter all the way out in the pulmonary artery and measuring what's the real pressure out there. Because of the invasiveness of the procedure, this is not done very often. And so the way we diagnose or we suspect pulmonary hypertension, I should say, most commonly is via echocardiography again. And so via echocardiography, the evaluation of pulmonary hypertension classically has taken into account the speed of tricuspid regurgitation and very few other parameters. we have recently investigated how good that is in diagnosing pulmonary hypertension in dogs with mitral valve disease. And compared to cardiac catheterization, the gold standard, we actually found very similarly from what is reported in people that we can misdiagnose a lot of dogs. So just the echocardiographic evaluation of the pulmonary pressure could be wrong by plus or minus 30 millimeters of mercury, which is like a very big deal in terms of pulmonary pressures. And so a more recent approach and the more recent guidelines, they actually talk about looking holistically at several other parameters so that we can have an idea about how likely is this dog to have pulmonary hypertension rather than what is the pulmonary pressure.
And Michele, you have been one of the authors of these guidelines. So perhaps just a final comment on the pulmonary hypertension secondary to left-sided heart disease.
Yeah, so as Giulio said, the ACVN guidelines suggest that the diagnosis of pulmonary hypertension in our patient is based on the probability for this patient to have it. Unless you do cardiac catheterization, then is your likelihood probability. And I want to stress again, echo is important, but clinical signs in the guidelines are also very important, something that the clinician should be aware of. So if you have a patient with mitral valve disease that starts presenting syncopal episode, the pulmonary hypertension should be at the top of your list as a possible complication for these patients. And that's probably the time that you want to have somebody looking with the echo of this patient to identify if there is pulmonary hypertension or not. We also need to remember again that not all dogs with mitral valve disease and pulmonary hypertension have pulmonary hypertension because they have left-sided heart disease. They may have chronic respiratory problem. They may have endocrine disease that can lead to pulmonary thromboembolism. So they may develop pulmonary hypertension for another reason that is not left-sided heart failure. And then it's important because from the perspective of treatment, it's completely different. I mean, you want to treat a patient with pulmonary hypertension secondary to left heart failure with furosemide, but you don't want necessarily treat with furosemide a patient has pulmonary hypertension for other reasons. So it's a very challenging thing. So as something that you need to, again, look at your patient, assess the entire of your patient, not just focusing on one single parameter, because that can be misleading you and leading you to a wrong diagnosis or treatment.
Well, thank you both so much for sharing this knowledge and the study with us. We have Michele and Giulio who are talking about diagnosis, but please stay with me as we wrap up part 2. We have a few quiz questions for our audience. So let's scan the code if you haven't done so, and let's go and check what questions we have coming. So let's see. The first poll question here is, what is the mean survival time for a dog in stage C? The mean survival time. Here, only one possible answer. You have 4 options, whether it's 6, 12, 14, or 24 months. And I'll give you a few moments to vote. We'll see how you'll do on that. So right now, I see that about half of the people are saying 12 months. Then the rest, a third, is kind of shared between 6 and 14, and a few think that it's 24 months. I'll give you a few moments. Michele, what is the correct answer?
I think most of the study clearly show that 12 months once a dog is in heart failure is the right answer.
Okay, so more than half of you got it right. Good. Let's move on to second question. We have one more for you. The second poll question is, what can be considered the best predictor of prognosis? For options again, only one is correct. Is it size of the left atrium? Is it the size of the right ventricle? Is it the width of the heart wall or the diameter of the aorta? I think this one I can get right. Let's see. Okay, so we have 95% who say the size of the left atrium. Pretty unanimous on this one. Giulio, are we right?
Yeah, absolutely. Size of the left atrium is one of the best prognostic indicators.
Fantastic. I see the questions coming. Very good. Keep them coming. We have the Q&A, and we'll see you both at the Q&A in a moment. And now let's move on to the part 3. Part 3, where we will be talking about treatment options. And let's meet our third and final expert duo.